What is auscultation in a lung cancer physical exam? Imagine your doctor listening carefully to your lungs with a stethoscope, trying to catch subtle sounds that reveal what's happening inside. That's what auscultation is all about. It's a vital part of the physical exam when doctors are checking for lung problems, including lung cancer. After they look at your chest, feel it, and tap on it, they use auscultation to listen to the sounds your lungs make when you breathe. This helps them spot signs of issues like tumors, airway blockages, or other complications. During auscultation, the doctor systematically places the stethoscope on different parts of your chest. They listen to the upper, middle, and lower parts on both the front and back of your chest, including the sides. To get the best sounds, you'll be asked to breathe deeply through your mouth. This allows the doctor to hear the full range of lung sounds and identify any abnormalities. They listen for normal breath sounds, which are soft and rustling, but also keep an ear out for unusual sounds. In cases of lung cancer, auscultation can reveal several telltale signs. For example, if a tumor blocks an airway or causes part of the lung to collapse, the doctor might hear diminished or absent breath sounds over that area. If the tumor causes the lung tissue to fill with fluid or become inflamed, they might detect crackles or rales. Those are brief, crackling sounds often associated with fluid or inflammation. Sometimes, the doctor might hear bronchial breath sounds, which are louder and higher pitched than normal, indicating that air is moving through a solid or dense area like a tumor. They might also notice a pleural friction rub if the tumor irritates the lining around the lungs, causing a grating sound. Auscultation doesn't work alone. It's combined with other tests like percussion, which involves tapping on the chest to listen for changes in sound that suggest fluid or solid masses, and palpation, where the doctor feels for vibrations called tactile fremetus. When these findings are combined, they help the doctor form a clearer picture of what's happening inside the chest. This technique is simple, non-invasive, and cost-effective. It provides immediate clues about lung health and helps guide further testing, such as imaging scans or biopsies. For example, if auscultation reveals abnormal sounds over a certain area, the doctor might order a chest X-ray or a CT scan to get a detailed look at the suspected tumor or other abnormalities. In summary, auscultation in a lung cancer physical exam involves the careful listening to lung sounds with a stethoscope to detect signs of tumors or related issues. It's an essential step that helps doctors identify areas of concern, understand the extent of lung involvement, and plan the next steps in diagnosis and treatment. Remember, every patient is different, and findings can vary, so always consult a healthcare professional for personalized advice and diagnosis.